Hello and welcome. You're watching Health and Wellness Save a Life. I'm Gargi Rawat. It's a sad but true fact that the number of people dying from cardiovascular disease is steadily rising in India, and most of these cardiac deaths are sudden and on the spot. It's possible to prevent these sudden cardiac deaths if they receive immediate medical attention and CPR. There's also an alarming rise in the number of young patients with heart attacks and sudden cardiac arrest. Many adults in cardiac arrest can be revived with intact neurological function if bystanders provide immediate CPR. Raising public awareness and understanding of the practical applications of CPR is an essential strategy to increase the success rate of CPR in cardiac arrest cases. Save a Life is an initiative through which people will be made aware of early signs and symptoms of cardiac arrest, train them on CPR, and highlight the role of CPR in saving a life. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We're joined by Dr. Prem Ratan Degawat, Senior Interventional Cardiologist, Eternal Hospital, Jaipur. Dr. Suresh V. Pater, Professor and Head of Department of Cardiology, KLE Hospital, Belgaum. And Dr. V. S. Ramachandra, Chief Cardiologist, Sri Holistic Hospital, Hyderabad. Thank you so much, doctors, for joining us on the program today. Dr. Pater, during cardiac arrest, what happens to a person? If you can explain this and, explain to us just what is cardiac arrest.
Cardiac arrest is actually an emergency condition. It occurs very suddenly. Normally, there is an electrical system of the heart which keeps sending the electrical impulses, and the heart keeps beating at a rate of 60 to 100 per minute, so that there is an adequate cardiac output or the blood flow to the various parts of the body like a brain, lungs, kidneys, and the muscles of the body. And when the electrical system of the heart fails, the heart is unable to pump the blood. As a result, there is no blood supply to the brain, the muscles, the kidneys, and the lungs. So what happens is, the person, if he were to be standing, he will fall down to the ground because the muscles is not receiving and is not supporting. The brain is not receiving the blood supply, the person becomes unresponsive. The person, if it continues for a longer time, it can lead to convulsions and the person may have a death. So as a result, it is very important whenever we see a patient of a cardiac arrest to introduce a CPR and help him. Otherwise, the death can be there. And in general public, it is a notion that, cardiac arrest is equivalent to heart attack. It is not so. In heart attack, there is a blockage of the blood vessel and there is a less blood supply to the heart. Heart attack can be one of the cause of cardiac arrest, but not all cardiac arrests are because of the heart attack. Cardiac arrest can occur in the structurally normal heart individuals also.
All right. Dr. Ramachandra, if you can tell us now, how common is sudden cardiac arrest in India and can it be prevented?
Yeah, actually sudden cardiac death is a very common way of people to die when they have a heart attack. If you look at it statistically, half of all deaths due to heart attacks in any country happen before the patient reaches the hospital. And all of them are because, like what Dr. Patel said, because of an electrical problem called ventricular fibrillation, when the heart is really not able to pump blood. So all of these deaths can be prevented easily if there is a device called an automatic external defibrillator, which is a simple device. Once a person has chest pain and if he falls down unconscious, if you put these patches on, it analyzes that electrical rhythm and gives a voice prompt for you to press a button so that it delivers a shock and can get the patient out of this dangerous rhythm. The other one, of course, is cardiopulmonary resuscitation, which every person should know. So if there is a bystander when a person falls down, and if he starts CPR, he can save quite a few lives. If the CPR is not done, for every minute, 10% of lives are lost, which means after a person with a ventricular fibrillation or once the heart stops and he falls down, for every minute, 10% of people die permanently, which means after 10 minutes, there's really not much a healthcare person can do, even if he is able to reach at that time. So it's very important. Especially in India, the main problem is half of all our heart attacks happen in people less than around 40 to 45 years. So, and this is really almost 10 to 20 years younger than any other population of the world. So we see a lot of these young people who have for the first time the first symptom of a heart attack in 90% of cases is a heart attack itself, which means it doesn't come telling you many times. Over a month, it doesn't have, many times people don't have chest pain and then have a heart attack. The first symptom is heart attack, and almost half of all deaths due to heart attacks happen before the person reaches a hospital, statistically. So from this, you can estimate how common is sudden cardiac death. Sudden cardiac death is very common, and the commonest cause, of course, is a heart attack. But then there are a lot of people, especially during COVID times, they had viral myocarditis, which means, there is viral infection of the heart, or for some other reason, a person could have a pumping dysfunction, which means the heart stretches and has become big. Even in these people, the commonest cause of death is again sudden cardiac death because of this electrical problem called ventricular fibrillation. And these can be prevented if a person has a pumping dysfunction. If his pumping capacity is less than 30 or 35%, they need to get a pacemaker-like thing called an implantable defibrillator, which continuously monitors this person's heart rhythm. And for some reason, if it is beating very fast, before the person falls down unconscious, the ICD device can shock them out of that rhythm problem. So this is also a very important treatment that can prevent sudden cardiac death. But if you ask the whole story, the easiest way to prevent sudden cardiac death is to prevent heart attacks. And this is a very preventable disease. We know now that 90% of heart attacks can be predicted by very easy means, and almost 90% can be prevented, because this is a lifestyle disease. This is a man-made disease.
All right, very important to keep all that in mind. Now, you spoke about CPR. So, Dr. Patel, if you could just explain to us, what is the first thing one should do if someone goes into sudden cardiac arrest? What should one, look for, and what action should be taken?
Whenever we see a patient who has got a cardiac arrest, what that we have to do is first make sure that the person lies on the flat surface, so with his back on. As the person is lying on flat on the surface, we should call for the help if some other people are there. Scream for the help. Let the people come. Ask them to call the ambulance. So that by the time the ambulance is coming, what we should be doing is we should be looking at the pulse of the individuals, whether the pulse is there or not. Meanwhile, try to shake him up and see that whether he is able to respond or not. If you shake him up, if he is not responding, then we think that there is something very seriously wrong. Then look at his breathing. Is he breathing well or not? If the breathing is not there, then we have to think that the person has got a cardiac arrest, and this is the time that we have to become active. The moment we realize that the person has got a cardiac arrest, we should start doing a CPR, where we have to locate the center of the chest in the sternum. Then we need to keep both the hands in the center of the chest and compress the heart. We have to compress at least by 2 inches depth down, so that we produce effective cardiac contraction and the heart is able to pump the blood to the systemic circulation. We have to beat it, compress it at a rate of around 100 to 120 times per minute. Because that is the rate at which the body circulation is maintained. And what we should do is, if there is another helping person is there, for every 30 compressions that what we are giving to the chest, there should be 2 mouth-to-mouth respiration. If that can be done, it will be very good. Then the question comes, how long one should keep on doing this cardiac compression? We have to continue this CPR till the medical ambulance or the medical help comes and tries to take care. Or if the cardiac arrest has taken place in public places, if there are artificial external defibrillators are available, we should apply the external shock to the individual and try to help the person. Because time is very precious in these individuals. The earlier we institute CPR in these individuals, we can really make the difference in the survival and the outcome of the patients, these individuals.
All right, so you spoke about CPR. Dr. Ramchandra, if you could now explain, for a lay person, how will they know that if they're doing the CPR with the right technique, and what results from CPR should they expect and at what time?
Yeah, so when do we start a CPR? So when a person has a chest pain or even without a chest pain, if he falls down unconscious, which is called syncope, then if you know how to check the pulse, you can check for the pulse. But if you really don't know, you can see if he's breathing. And if you think he's not breathing, you start the CPR or the chest compressions immediately. Many times, if you are quick enough and if you do it properly, you can see that the person regains consciousness, means the patient or the person who is lying down on the floor starts looking at you. So this is a very amazing thing that once you start doing CPR, he gets back his consciousness, and that's the best way for you to know that your CPR is working. But the best way to do CPR properly is to train and to train others also. When you train somebody else, you know how to do it. So there are mannequins available where there are fake, sort of dummy, sort of body structures available where you can press, see how well you're pressing and whether it is going to be effective when you really do it. So the best way to do it is to train yourself and to train others also in CPR and be ready to do it. Because no matter how many times we read it theoretically, once we see somebody close to us or somebody near us fall down unconscious, it's really difficult for us to start things immediately, like Dr. Patel said, for us to check pulse immediately, to check breath immediately. In the meantime, ask somebody else to call the ambulance, ask somebody to get an AED if it's available in a public place, then start CPR, and if there's some other person, ask him to give a couple of breaths every 30 times you press. So all this thing needs a lot of training and coordination. So unless we train properly, we will not be able to do it first time just by reading it. So that's very, very clear.
All right, so with that, we'll switch into a short break and return with more questions. We have many more questions for the doctors. Do stay with us. Welcome back. You're watching Health and Wellness, Save a Life, and we're talking about heart health and CPR. We're now joined by Dr. Degawat. And Dr. Degawat, while not all heart problems have the same symptoms as depicted in movies, certain indications are worth noting and scheduling a doctor's appointment. So if you could explain to us, how does someone know if he or she has a heart problem?
So definitely, the problem is, a heart problem is very much well going on this society. And the most common symptom that is very important to notice is that shortness of breath. Means that you are comfortable at rest, but whenever you do your activity like climbing stairs or when you have to go some outdoor work, you feel breathlessness. That is the most common symptom that we have to notice. Associated with this, if there is a swelling feet or there is excess sweating on exertion, like doing household work with the excess sweating, with palpitation. Palpitation means feeling of the heartbeat, extra beats, and there is nausea on heavy exertion. These are all initial symptoms which we should consider in our healthy lifestyle, because these symptoms, I think most of the person who have the cardiac disease, they feel, but they don't understand the symptoms. So shortness of breath is very essential to think. And how we know that we have shortness of breath? We have to be physically active. The problem is that somebody says that I'm healthy. Healthy doesn't mean that you are healthy. If you walk a speed of 6 to 7 kilometers per hour without the shortness of breath, that is, we call it healthy. So we have to consider the definition of the healthiness, that we have to be active. So first thing to detect your heart disease is to be active so that you can detect your problem.
All right, Dr. Patel, almost every family has at least one person with cardiovascular disease. Tell viewers, how important is it for the patient caregivers and relatives and family members to learn CPR?
So basically,
almost every family member has got one heart disease patient, whether you see at home or you see at your workplace. As per one of the studies, the cardiac arrest, most of the time, it occurs at home, 70% of the individuals. In another 15% of the individuals, it occurs in the offices. So it is very important for the caregivers and the family members to know how to give a prompt CPR in the individuals who have got a heart disease. because they are the first person who are going to be there with the patient and who are going to be helping the patient. And the time is going to be very precious in these individuals. Persons who are having a cardiac disease, once they have a cardiac arrest, in a matter of minutes, it is going to decide whether the person is going to survive or whether the person is going to make it or not going to make it. So the family members should know exactly how to give the CPR. That's what we told right now. Apart from knowing how to give a CPR, they also should know their family doctor's telephone numbers, their cardiologist number, how to call for an ambulance. These all small little things play a very big role in making the person survive. And the introduction of prompt CPR can increase the survival rate of the person at least by 2 to 3 times. So it is very important.
All right. Dr. Degawat, what other causes could lead to sudden heart attack in a healthy individual with no associated risk factors?
Sure, because you heard in lots of newspapers that a healthy individual suddenly collapsed. So most common cause of the sudden collapse is that there is a genetic factors. The disease sometimes runs in the families, like hypertrophic cardiomyopathy, the disease of the cardiac muscles, in which it generates an ventricular fibrillation suddenly. So some type of genetic problem, some genetic channelopathies are there, in which the cardiac muscles have tendency to be in ventricular fibrillation, which we call the cardiac arrest. So these are the changes. Sometimes there is leakage in the valve, or sometimes stenosis in the valve can lead to the sudden cardiac arrest. So these are the basic scenario where the genetic factor leakage in the valve can be associated with a healthy individual, which I have said earlier that all things can be detected earlier. If you have a family history of sudden cardiac death in your family or sudden death in your family, you have to go with your cardiologist and consult him that if there isn't any heart problem with us or not.
Right. But Dr. Degawat, what if the person has an ICD or a pacemaker and they have a cardiac arrest? Can we then perform CPR on such patients?
So CPR can be performed on the pacemaker, but the ICD is done for to prevention of the cardiac arrest. So definitely the ICD is the prevention for the cardiac arrest. So on the pacemaker, CPR can be done very easily, but on ICD, if there is ICD, we have to be cautious because during CPR you can get the shock from the ICD. So we have to be cautious during the CPR during the ICD, but pacemaker is not a problem.
All right. Dr. Ramachandra, can a heart attack or sudden cardiac arrest, it's more likely to occur in people with existing heart problems or diabetes. So what information should they carry on them while going out?
No, actually, it's people have something called LV dysfunction, which means their heart pumping capacity is reduced. This is commonly called as heart failure. Normally, the heart is able to pump out, if it receives 100 ml, it pumps out 70 ml. So you call the capacity or the ejection fraction as 70%. So if it's less than 35%, then these people should get an ICD implanted. ICD is a pacemaker-like thing that actually can, continuously monitor the rhythm and shock them. And if they have the device, they can carry that card also. But otherwise, there are so many diabetics, so many people with high blood pressure, so many people prone to heart attacks. So really, it's not that they can carry something. What they should concentrate more is that they themselves can prevent almost 80 to 90% of heart attacks. Like I said, the main causes of sudden cardiac death are number 1, heart attacks. Number 2 is the heart failure, or for some reason the heart pumping capacity has reduced. Or number 3, like doctor was telling, it's a genetic issue, which means there is a family history of sudden cardiac death. So these 3, if we are careful and we take the proper measures, we can prevent a lot of these sudden cardiac deaths. Sudden cardiac death is more preventable by the person himself than by a bystander who sees him. For a bystander who sees a person falling down suddenly unconscious, of course, he has to initiate CPR, get the automatic external defibrillator if it's somewhere nearby. But these things can save very few lives compared to the number of lives that can be saved if people take proper medicines, proper tests, and proper lifestyle measures to prevent heart attacks.
Right. Dr. Degawat, people survive a first heart attack but then are at increased risk for another one. If you could tell us what precautions should they then take to reduce the chance of a second heart attack?
So definitely the first is that the medication should be the timely. He or she should take the medication timely, because the lifestyle modification as well as the risk factor modification is very important. The lifestyle that we has to walk daily according to cardiologist, and the medication like his BP medicine, his diabetes medicine, his cholesterol lowering medication should be in the ideal and optimized by the cardiologist, so that he can be and very much optimized on the medication. And the last thing is that he should be stress free, because the stress having the major role in doing in this type of cardiac problem, it can precipitate the cardiac arrest. So overall, in the last in summary, my view is that you should take the medication, lifestyle modification, risk factor modification, and stress free is the key to prevent a heart attack.
All right. And Dr. Patel, does cholesterol accumulate right from an early age, or is it only after 40 years of age that a person needs to worry about this?
It's a wrong concept among the people. The cholesterol accumulation takes place after the age of 40 years. Cholesterol accumulation can start much earlier than that. It can start as early as second decade of life, third decade of life also. Post-COVID, we have started seeing the patients in the second and third decade of life also. Earlier, when I was doing a medical schooling, the children used to bring their parents to the hospital saying that my father has got a heart disease and a heart attack. But the story has changed now. Nowadays, we see the people, the father gets his son or a daughter saying that they are having chest pain, doctor, please see it and look into the matter. So what does that mean? That means the cholesterol deposition has been taking place much earlier. What are the causes for this? Very bad lifestyle. Eating gutka or this tobacco in younger age group, smoking, if they are having a high blood pressure, if they are having associated diabetes, overweight, poor food habits, and a family history of dyslipidemia, what we call it, where the familial cholesterol is on the higher side, what we call it familial hypercholesterolemia. These individuals are likely to have a heart disease at a much younger age group as compared to after the age of 40 years. So it is a wrong concept in the public that heart disease or cholesterol accumulation takes place only after the age of 40 years. It is more common after the age of 40 years, but certainly yes, it occurs at a much younger age group. More so in post-COVID period, we are seeing in second and third decade of life also.
All right. So that's something to keep in mind even for our younger viewers. Thank you so much, doctors, for joining us on the program and talking about this very, very important issue and creating awareness about it. Thank you all for watching at home. Goodbye.